All right, hello everyone. I see some people coming in. Got a couple of people signed in already, and we'll just wait a couple more minutes before we get started here. Good evening, everyone. Got a couple more people coming in. We'll get started promptly at about 7:01 for all the last minute people coming in. We'll record this meeting so you can reference it in the future as well, but welcome everyone. Welcome. If everyone wants to put in the chat, we'll have that going on. You can put in questions there. I'll look at those at the very end, and we'll get to those. And if you want to get started, you could just put where you're coming from, if you're in the city of Chicago or elsewhere, and we can kind of get an idea of where everyone is at. All right, looks like we got someone from Arlington Heights. Welcome everyone. We'll get started in just a couple of minutes. If you want to just put where you're from in this, we'll kind of get an idea of where everyone's coming from. Again, we'll be recording this for future reference as well. But anytime during the presentation, if you would kindly keep your questions to the end, you can put them in the chat, or we can pick up a couple of them at the end if we have time. And we'll handle some of those. I've got a couple of preloaded question and answers that answer a lot of those. So I imagine some of those questions that you might have will be on there. All right, so the chat is going to be mostly in the question and answer section. That's where I'll be able to see. I had a question come up there. Again, welcome everybody. We're about to get started here. All right, so here we are tonight. Thank you everyone for coming in. We're going to get started with our presentation so we can get everyone on their way, get you the information that you need and signed up for. I'm Dr. Michael Tagge. I'm a double board certified podiatric physician. And the reason you're here is probably because somewhere along the way, a doctor told you that fixing your bunion meant screws in your foot, a cast, a boot, crutches, and weeks off your feet. And you took one look at that and thought, not yet. I want to show you why that instinct was correct and what has changed. So over the next 45 minutes or so, I'm going to walk you through how a modern bunion correction works, who it is for, who it is not for, and how to find out where you personally stand. This is going to be education first. There's no pressure in here in either direction. By the end, you will understand something most people with a bunion never get told, and it changes your entire decision. But before we start, type in the chat where you're watching from today if you haven't already, so I can see who's in the room. So we got someone from Arlington Heights, and I imagine most of people are here from the Chicago area, but hopefully we've got a couple more that are coming in. But we'll keep moving on. So we tried the wider shoes, the orthotics, and the spacers. And you noticed it years ago, that bump that keeps getting a little wider. Your favorite shoes quietly went into the back of the closet. And there was that moment in a shoe store when nothing on the wall seemed to fit the way it used to. And you told yourself that maybe it's just cosmetic and it was not bad enough yet, and that you would deal with it when you had time. So you did reasonable things like wider shoes, orthotics, toe spacers you order online. Maybe you got a cortisone shot along the way. They take the edge off, but the bunion kept getting worse. Here's what you want to hear. You're not vain, you're not imagining it, and you didn't fail. You were given options that were never going to stop this, and then told the only real fix was something that sounded worse than the problem. If any of that described you, type "that's me" in the chat. I want to know that you're in the right room. All right, we got a couple of people here. So I want to ask you one commitment before we go any further, not to me, but just to yourself. If by the end of this, the science makes sense to you and you see yourself in the patients I'm describing, promise me you don't let that fear or old habit stop you from finding out whether this could work for your foot specifically. Not booking surgery, not just yet anyway, but finding out where you stand. If you can make that promise to yourself, type "I promise" in the chat right now so you can get things online and hold a little bit of accountability. I'm seeing a couple come through, so thank you for all those. Now hold on to that because I'm going to come back to it at the end. So a little bit more about me. As I said, I'm Dr. Michael Tagge. I'm a doctor of podiatric medicine, double board certified in foot surgery and in regenerative foot medicine. I spent my career focused on one part of the body, the foot and the ankle specifically, and on the forefoot. This focus matters, and I'll show you why. Patients often travel from outside Illinois to have this done, not because I advertise, but because there are very few places that do bunion correction the way I do it. I want you to understand what this way actually is. All I ask as I go through this is one thing. Just keep asking yourself, does this make any sense? Because that's the only question that matters to you today. Most people aren't afraid of the procedure. They're afraid of the recovery. Let me say out loud what you've been probably thinking. You're not actually scared about getting the bunion fixed. You're scared of the recovery. The boot, the crutches, sleeping with your foot for weeks, often 6 weeks or more, asking everyone to drive you around, losing the chunk of your summer or your season. And I want to be clear, that fear is totally rational. Those recovery stories absolutely are real. Your friend who had it done, your sister maybe, the horror story you saw online, none of that's made up. Here's the part that no one's explained to you though. That recovery belongs to one specific type of surgery, the traditional open surgery. It's not the price of admission for every surgery. And once you see the difference, you can't unsee it. If you've been putting this off specifically because of the recovery, I want you to type recovery in the chat. I promise you're about to feel a lot better about your options. All right, and we got a couple in there. So I want to show you a couple of things that patients have said in their own words, not because they're unusual, because I want you to start hearing the pattern. So the first one came in for a second opinion. She didn't even know minimally invasive surgery was an option. In less than 8 weeks, she was already back to walking 2 miles on her bike and back to bowling. Notice she didn't say pain-free miracle. She said got her life back. And that tends to be the pattern. No screws, minimal recovery. And this one flew in from out of state because this approach is not on every corner. And I want to say this very clearly because it is true. Individual results do vary, and every foot is different, which is the whole reason that evaluation at the end exists. First, I'm going to show you over the next 40 minutes why this keeps getting worse no matter how many wider shoes or orthotics you buy. And when you see it, you're going to be a little bit annoyed that nobody's told you anything sooner. Second, the real story behind why Bunion's surgery got its brutal reputation, what those screws and that hardware are actually for, and why that is no longer your only option. And third is, and this is the one people emailing me about, because we corrected the deformity through an incision smaller than a grain of rice. No screws, no general anesthesia, and walking the same day. And fourth is the honest part, who this is actually for and who I turn away, because not everyone is a candidate, and you deserve to know where you stand before you spend a single dollar. So let's get into it. So before I teach you anything, I want you to start brainstorming with me a little bit. I want you to picture something. It's called next summer. Bunion's behind you. It's not managed, not hidden, but totally behind you. You're getting dressed and you reach for the sandals first without even thinking about it. You're at the beach and the feet are just your feet. They're not the thing you're angling away from the camera, and you're not the thing people are worried about looking at. And you walk back into the studio class you quietly stopped going to. You play the back nine in your normal golf shoes, and your foot's not the reason you stop anymore. That version of you is not a fantasy. For a lot of my patients, that's only a couple of weeks away. The real thing standing between you and our picture here is information, the information that you're about to get. So let me earn that promise you made. This is how it actually works. Here's exactly where we're going. Step 1, why waiting was actually the smart move. Step 2, the difference that changes everything, how this surgery is a fundamentally different category. Step 3, the part most surgeons skip entirely, how we engineer the recovery itself. And step 4, the honest conversation of who this is for and also who is not for. 4 steps, about 40 minutes. By the end, I hope you'll understand more about your own foot and your real options than most people ever get told. And then I will show you this simple next step if you want answers specific to you. Let's start with the one that surprises people most, why you have been right to wait. Let me show you what most people picture, and honestly what most people are still offered. Traditional open bunion surgery. The surgeon makes a large incision, cuts the bone, shifts it over, and then holds the correction in place with a permanent screw or metal plate. And here's the thing, because that hardware is doing the work of holding the bones together, your foot has to be protected while the bone heals around it. And that's where the cast comes in, and the boot, and the crutches, and the 6 weeks of staying off of it. And the recovery you've been dreading is not random. It's the direct consequence of how that surgery actually works. So if you looked at all of that and thought, not yet, I want you to hear me. That was not weakness. That was a completely rational read of a real trade-off. You are right to wait for a better option. So waiting made sense, but I have to be honest with you about the other side of that, because you would want me to be. Bunion is a progressive deformity. It does not hold still while you think about it. The angle tends to widen over time. The toe drifts further. The tendons keep pulling things apart. And the longer it goes, the more involved the eventual correction can become. What that means in real terms is that every season you wait is another summer of hiding your feet, another year of the bump winning, and potentially more complex correction down the road. The wait was smart, but indefinite waiting quietly costs you as well. So let me ask you this. If there were a way to correct this without the recovery you've been avoiding, is there any real reason you would keep putting it off? If not, I want you to type no reason in the chat if you're still with me. All right, great. Got a couple there. So that's step one. Let's go on to step two. What is the difference? The recovery you have been afraid of is real, and it's a direct result of the old surgery. Waiting for a better option is definitely the right call. If that lands, do me a favor and type "makes sense" in the chat. Now here's the part I've been wanting to show you, because if the recovery comes from the hardware and the downtime, the obvious question is, what happens when you don't use any? Here's the difference that changes the entire decision for almost every single patient I see. With a minimally invasive approach, the correction happens through incisions smaller than a grain of rice. 4 millimeters is what I usually tell everyone, which is, if you look at the example there, you can see it's very small. That number 4 is right, half the size of a grain of rice there. I want you to let that land and think about that. It's not a big incision. It's something you could cover with that grain of rice. But I don't want you to take my word for it, so let me show you. Here's what a correction actually looks like on a real patient. On the left, the before picture, very severe bunion, and on the right, the same foot, corrected. Notice the angle of the big toe. Notice that bump is gone, and the toe is sitting back where it belongs. And also notice what you don't see. No giant scar, no visible hardware. This is the kind of patient that I mentioned earlier. My patient CK, an acronym there, came in for a second opinion, did not even know that this was possible. Less than 8 weeks later, 2 miles on the bike, back on the bike, 2 miles on foot, back on the bike, bowling again, and completely back to her prior activity level. I'll keep saying it because it's true. Every foot is different and individual results vary, but that's the pattern that we're aiming for. Right now, a part of your brain is probably saying, okay, but this is still surgery, and surgery probably still hurts. And that's fair. So let me answer that part correctly. Most of the pain people associate with surgery comes from 2 things: the large incision and all the soft tissue that it disrupts. And the implanted hardware in your body has to heal around it. The minimally invasive approach addresses both at the source. Tiny incision means far less tissue disruption. No permanent hardware means we're not just masking the pain with stronger medication afterwards. We're removing the things that cause most of the pain in the first place. One of my patients put it very simply: the surgery did not hurt at all. Now, I'm not going to promise you that, because every person is different, and I'm not going to make promises I can't keep. But what I can tell you is that this approach is built specifically to minimize pain from a structural perspective. So now you've seen it, a complete structural correction through a tiny incision, no hardware, local anesthesia, walking the same day. The surgery itself is in a different category. If you're still with me, I want you to type yes in the chat. All right, keep going on. But here's what separates from a good outcome from a great one. It's not just the surgery. It's what happens in the days and weeks afterwards. And that's the part that most surgeons barely think about. I'm here to tell you that I built an entire system around it. So let me show you that next. Everything I've shown you so far, the correction, the no hardware approach, the same-day walking, is the front end of something bigger. I call this the Prism Reconstruction System. And the reason it has that name is because it treats the surgery and the recovery as one integrated system, not 2 separate events. From a traditional perspective, most surgeons are going to hand you off the moment the procedure is done. Their work is done, and so are they. Prism is built around the opposite idea, that how you heal matters just as much, if not more, than how you're corrected. So alongside the precision micro-incision correction, there's a structured recovery protocol, biologic support designed to help your body heal more efficiently. Better healing, faster healing, moving sooner, and fewer unnecessary setbacks. And this is what I mean by full spectrum healing. It's the difference between just getting the bump removed and actually engineering your return to life. Prism is the way I obtain the outcomes I do and why I include this with every patient. I want to ask you, does it make sense why I built this in this way? If so, type full spectrum if you can see the difference in the Q&A. So let's talk about what recovery actually looks like. What does it look like? Let me be specific and honest. It's not no recovery. It's a very different recovery. Most of my patients are back to regular shoes within about 3 weeks, often sooner. Many are back to non-strenuous activities such as daily routines within days, not weeks, because the whole thing is built around keeping you mobile instead of immobilizing you. I know a big reason that people stall is I cannot disappear from work for 6 weeks. With this approach, for most people, that is simply not the trade-off anymore. The recovery is designed to bend around your life, not the other way around. So the patient here, JJ, flew in from out of state, stayed mobile the entire time, and was back to activity sooner than expected. People don't travel across state lines for an average experience. So how do you know that this really works? You're an intelligent person, so somewhere in there you're asking the right question. How do I know this actually works, and I'm not just listening to a really great story? Good, that's what you should be asking, because it's for some people this sounds way too good to be true. And here's my honest answer. 1, I'm a double board certified surgeon, and my entire focus is on the foot and the forefoot and regenerative medicine. 2, Prism is my defined trademark system, not something I improvise case by case. And 3, this is the one I would weigh the most if I were you. Patients are traveling here from outside of Illinois specifically for this. People do not get on a plane for a procedure they could get better and cheaper at home. But what I'm not going to do is throw a success rate percentage on the screen, because outcomes are going to vary by person, and you deserve real numbers about your foot, not just some marketing stat. And that's what the evaluation at the end is going to be for. So let's take stock. You understand why you were right to wait, and you have seen that this surgery is a fundamentally different category. And then you have also seen that the recovery system gets people back to their lives faster. If you've been nodding along, the only question left is a personal one. Is this right for you, and specifically? And that's exactly the right question, and it deserves an honest answer. So in my last step, I'm going to return to my promise I made and tell you the truth about who this is for, and just as importantly, who it is not for. I'm going to do something here that might surprise you for a webinar. I'm not going to tell you who should not do this, or at least not yet, because a surgeon who will operate on anyone is not someone you want operating on you. You are likely a strong candidate if you have a bunion that keeps progressing despite the shoes, orthotics, and spacers. If you are tired of managing it and you want a real modern correction with as little disruption to your life as possible. And I will be straight with you about who I optimize first or turn away. If you're an active smoker, we need an honest conversation, because smoking affects healing, and I don't want to set you up to fail. If you have uncontrolled diabetes, we're going to address that first. And if you're looking for an overnight guaranteed miracle, I'm not your guy, because I'm not going to make promises I cannot keep. So the real question is, which group are you in? And the honest answer is, I can't know that from a webinar. So this brings me to the most important thing I'm going to say today. Here's the truth. I cannot tell you from a screen whether you are a candidate. Neither can the internet, and neither can another round of guessing. The only way to actually know is a real conversation about your specific foot and your issues, what you've tried, where the deformity is now, and what you want your life to look like. And no, that doesn't mean booking surgery. That means finding out where you stand honestly with the person that would actually do the work. That's it. So let me show you exactly how that works and how to set it up if you want answers that are about you and not about averages. So let me pull this together, because you've learned a lot in a short amount of time. You now know why this keeps getting worse, why your instinct was to wait was rational. You now know that the recovery you've been dreading, the boot, the crutches, the lost weeks, belong to the old open surgery and not to every surgery. And certainly not the surgery that I do. You also now know that the correction can happen through an incision smaller than a grain of rice, with no implanted hardware and no general anesthesia. And you now know what the Prism system and full spectrum healing add to the recovery, and the honest truth about who this is for and who it is not for. That is more than most people living with a bunion ever get told. You're not where you were 22 minutes ago. So let me ask you 3 quick questions, and just answer honestly in the chat as we go. First question is, do you now understand why the shoes, the orthotics, the spacers were always going to lose to a progressing bunion? If yes, go ahead and type that in the chat. All right, got a couple there. Now, number 2, do you see why that brutal recovery you've been avoiding came from the old open surgery and not from this approach? If so, type yes. All right, got a couple there. And our last question, can you see yourself as someone who might be ready to find out where you stand? No commitment, no pressure. If so, type yes. I've seen quite a few come in, and they're still coming in. It's good because there's a lot of you that are in the exact right place where you need to be. So from here, you really only have 2 choices. And I want to lay them out plainly because you are an adult and this is your decision. Choice 1 is do nothing. You close this window, you go back to exactly where you were this morning. You go back to your shoes that don't fit, the feet that you hide, the bump that keeps winning and getting more painful as we go. And that's a real choice. But we already know where that story ends. And you've probably been living that nightmare for years. Here's choice 2. Let me actually take a look at your specific situation and tell you the truth about whether this could work for you. This doesn't mean booking surgery, doesn't mean pressure sales tactics, just an honest, expert answer about your foot. And honestly, we're going to keep moving on. I've made option 2 the next choice because we can't stick with option 1. I've set aside time specifically for people coming out of this training in my schedule. So let me show you exactly what that is. So your next step, if you want to get everything kind of fixed here, is going to be the Prism Candidacy Evaluation. It's a private 15-minute conversation on the phone directly with me, not with my front desk, not with the salesperson, me, the surgeon. Its entire purpose is to answer one question for you honestly. Are you a candidate for this approach? Yes or no? That's it. This is the gateway. This is the way you find out where you stand, not for me to pitch surgery to you. Remember the promise I made to you at the start, that you would at least find out whether this works for your foot, and this is how you're going to keep it. You'll see on the link and a QR code on the screen for the rest of our time together, and that will take you directly to how and where you should book. So here's exactly what you're going to get in your evaluation. First, this will be a direct 15-minute phone consultation with me, the surgeon, not an intake coordinator reading from a script. This is the person who is actually going to be doing the work. On its own, that kind of direct access to a surgeon is easily a $250 value. Second, a personalized candidacy assessment for the Prism approach. Remember step 4, where I said the only way to know if you're a fit is an individual conversation? This is that. When we look at your history, what you've tried, and your goals. Now let's call that a $150 value. And third, the most important part, a clear, honest yes or no on whether you should move forward with zero obligation. If you're a fit, I will tell you. If you are not, I'll tell you that too. Added up, that's easily a $400 of value in a 15-minute call. So a 15-minute evaluation of the surgeon, a personalized candidacy assessment, and an honest answer about your foot. Over $400 of value. A lot of practice would charge you just for the consultation. For people coming out of this training, the Prism Candidacy Evaluation is complimentary, totally free. And let me tell you exactly why. Because I don't want it to feel like a trick. It's free because it's genuinely the only way I can help you. I cannot tell you if I can fix your foot until we talk. So I'm not going to put a paywall in front of the one conversation that determines whether we are even a fit, because that seems a little backwards. So the link there is on your right, and the QR code if you are on a phone. Go ahead and book your spot now while we're still together. And let me make a promise about what this call is and not. I know a lot of you have quietly carried in some embarrassment about how long you let this go or how your feet look now. I want you to hear me. Coming from the surgeon that deals with all kinds of severe cases, there's absolutely zero judgment from my side. Choosing to deal with this is a sign of self-respect, not vanity. This is not a call where you get handed off to a salesperson and worked over. It is you and me, one-on-one, having an honest conversation. No pressure in either direction. If it's not right for you, that is a completely fine outcome. If that's the kind of conversation you've been wanting, make sure you book it now using that link on your screen. You might be thinking, what is the risk here? And for a free call, it's not money. The real risk you're weighing is, will I waste 15 minutes and will I get pushed towards something I do not need? So let me try to reverse both of those right now. I'll make to you a guarantee. If we get on this call and this approach is not right for you, I will tell you as soon as I know. It might not be immediately, we might get into the weeds a little bit, but I'm not going to string you along, and I will not try to make you a candidate if you are not. I simply do not accept patients I cannot genuinely help. So the worst case is you're going to spend 15 minutes and walk away with a clear, honest answer and a better direction. I don't really see that as necessarily being a risk. I look at that as being totally useful. With nothing to lose, there's no reason to wait. There's another issue I need to be straight with you right away about, and it's availability. Because I do each one of these individual evaluations personally, in between surgeries and seeing patients, I have very limited time to do them, which means there's only so many I can do in a given week. So here's the practical reality. The slots for people coming out of this training will fill, and they'll fill quickly. And when they do, the next opening is genuinely far out because my surgical calendar always comes first. That is not a pressure tactic. That's just how one-person surgeon practice works. If you book while we're together right now, you'll be in the first in line to get this week's slots. If you wait until tomorrow, I honestly cannot promise what's going to happen. So if you know you want answers, I'd recommend you claim that spot as soon as possible, if not now. Let me handle the things you might still be thinking, one at a time. First, maybe surgery itself scares you a little. That is completely human, and I would never tell you not to feel that. But here is what I want you to hold on to. Booking this evaluation is not booking surgery. It is a 15-minute conversation. Nothing happens to your foot on a phone call. You stay completely in control of every single step after it, including walking away. You don't even have to travel to the office. The call is just meant to replace fear with facts. So if the fear is the thing, the call is actually the cure. I'd recommend you book your consultation. Second thing you might be thinking, I can't vanish away away from work for weeks. I hear that constantly, and it exactly is why I built the recovery the way I did. Remember that weeks in the boot recovery is the old surgery. With my approach, most patients are back to non-strenuous routines within days, and that means work for most people, and regular shoes within about 3 weeks. Individual results vary, of course, but the disruption you are picturing is mostly attached to the surgery you are not going to have. And the evaluation is exactly where we map this to your real calendar, your work, your travel, your season. Book it and we'll figure all of that timing out together. Third, will insurance even cover this? Let me be direct because you would want me to be. This is a boutique concierge surgical practice, and that is my deliberate choice, not a workaround. Operating outside of the insurance system is exactly what lets me deliver this level of care. The surgeon direct access, the integrated recovery system, the predictable all-inclusive pricing with no surprise bills. Some patients do have out-of-network benefits that may apply, and we can talk about that. But here's the key thing for today. The evaluation itself costs you nothing, regardless of your insurance. So insurance is not a reason to skip the one free step that tells you where you stand. Book your call, we get your answer, and we will handle the financial picture honestly from there. Fourth, the fair question. How do I know this actually works? I respect that question, so let me answer it one more time and very plainly. I'm a double board certified surgeon with a defined trademark system I follow every time, not improvisation. And patients who get on planes from other states specifically for this. People do not travel for average. But the most answer is this. Stop taking my word for it and let me look at your foot. The evaluation is where the proof gets personal. And that is worth far more than any number I could put on a slide. Book it and get the proof that actually matters. The kind that's all about you. And the last one is the quiet one. What if you're not a candidate? What if you get on that call and it's not for you? I think that's the fear holding a lot of you back. So let me try to meet that one head on. If you're not a candidate, then this 15-minute call just saved you a trip to my office and the cost of a paid consultation you do not need. Finding out you are not a fit is not a failure. It is genuinely useful, an honest answer, and you will get it for free from the surgeon in 15 minutes. That is the entire reason this call exists, so that no one books a paid consultation without knowing they qualify. So whether the answer is yes or no, you win by finding out. So book your call. Let me make this extremely simple, so there's nothing to figure out. 3 steps. Step 1, click the link on your screen, or just lift up your phone and scan that QR code with your camera. Step 2, pick a time that works for you and put in your details. It takes about 60 seconds. Step 3, you'll get a confirmation, and then at the time that you scheduled, you and I will talk directly on the phone. That's the whole thing. 60 seconds now to get a real answer about something you've been carrying for years. Go ahead and do it while we are together before the spots get booked, and this is when actually people follow through. The address is right there on your screen if you wanted to enter that into your URL. Before we open it up for questions, I wanted to take you back to where we started. Remember that picture I asked you to hold in your mind? Next summer, reaching for the sandals first, your feet are just feet at the beach. Walking back in that class you quietly stopped going to. Connect that vision to your action now. That version of you is not far away, and the entire distance between you and her is one 15-minute conversation. That's it. Not surgery, not commitment, a conversation. So you made yourself a promise at the start of this, and this is how you keep it. Book your call today. So here I put a list of lots of questions that I commonly get, and I'm going to answer these, and then I will take any questions that come through on the question and answer as we have time for. So is the 15-minute call really free? Is there a catch? It is genuinely free, and the reason is simple. I can't help you unless we talk, so I'm not going to charge you to find out that. The catch there is the slots are limited because I have to do them myself. Second question, I've had a bunion for a long time. Here it's 20 years, and it's pretty severe. Are you too far gone? Great question, and I can't answer it specifically from here, and that's the whole point of the call. But what I will say is that severity and how long you've had it is exactly 2 of the things we're going to assess on the evaluation. Don't disqualify yourself based on severity. I have treated mild, moderate, severe bunions. Let me do that, or hopefully not disqualify you. So book your call and we'll figure it out together. You've tried orthotics and a cortisone shot already. Is this different? Yes. Orthotics and injections manage the symptoms. They do not stop your deformity from progressing. Surgery is what corrects the deformity itself structurally. Whether it's right for you, however, is what the evaluation is going to determine. So be sure you grab your slot. How soon can you actually have this done if you're a candidate? So it really depends on your candidacy, your calendar. Some patients will book and schedule this months out. Some people want to get it done as quickly as possible. The evaluation call is where we try to figure out the initial steps of timing to map that to your own schedule. So what I'd say to you is book the call and we'll figure it out together. Do you have to decide anything on the call? The answer to that is no. You decide nothing on the call except whether you want to schedule an in-person consultation appointment and take the next step to figure out your exact situation. The initial call is just information, not commitment, which I would say is you have no reasons not to book based on that. All right, let's see if I can look up some of these other questions that are on. Seems like there is a link issue happening with the booking. So what I will do for you is make sure that my team gets out and sends an updated link to all the webinar attendees, and we'll have a direct link to the booking site for that. Right, any other questions that are coming in here? How does arthritis complicate surgery? So that's a great question, and it's on a case-by-case basis. So it depends on the type of arthritis, and we'll get into the weeds a little bit on this question because most people with bunions do have some sort of aspect of arthritis. And what we do is we're going to kind of take a look at which type it is. So there's intra-articular to extra-articular arthritis. So if it's extra-articular, we'll clean that up during the surgery. If it's intra-articular, we might do some extra work to try to depressurize the joint during the actual procedure itself. But arthritis is not a contraindication to having bunion surgery. How is the bunion removed? So the bunion is removed through, it's a very precise, what's called a bone cut, an osteotomy. We shift the bone over mechanically. It's not just a simple shaving of the bump, and it's done through those micro incisions that you've seen. In terms of other conditions that I treat, there's a question about plantar fasciitis. Typically, I'm not going to treat things outside of surgery. I run a mostly surgical practice. There is some aspects for sports regenerative medicine that is kind of for existing patients, but typically I will just confine myself towards surgery because that's where I do the best work. All right. So let's move on and finish this off because we're right about at 40 minutes, which is the time I promised for you. So I want to leave you with just one thought. For years, this decision has been driven by fear of the recovery, fear of the unknown. Tonight, I hopefully gave you a lot of information that changes that. So I want you to decide from information, not from fear. I think you've managed this bunion long enough. You know there's another way, and you know that the only thing standing between you and an answer is one short conversation. Take it. Make sure you book your 15-minute evaluation as soon as you possibly can. It's been my pleasure to walk you through this. I hope we get to talk to you on a call soon. Take care of yourself and take care of your feet. Have a good night, everyone, and thanks for attending.